Have you ever wondered what happens when the aortic valve doesn't function properly? Well, the answer lies in understanding a condition known as aortic valve regurgitation. In a healthy heart, the aortic valve closes tightly after each heartbeat, ensuring that blood flows in one direction only, from the heart to the aorta and then to the rest of the body. In aortic valve regurgitation, however, this valve doesn't close properly. As a result, some of the blood that was just pumped out of the heart leaks back into it. So what causes this valve to malfunction? There are several culprits. It could be due to a congenital heart defect, meaning you were born with it, or it could be the result of other medical conditions such as infective endocarditis, rheumatic heart disease, or aortic valve stenosis. Now, what happens when blood leaks back into the heart? This backward flow of blood, known as regurgitation, increases the volume of blood in the heart. As the heart works harder to pump this extra blood, it gradually becomes weaker. This can lead to symptoms like shortness of breath, fatigue, and chest pain, symptoms that could be mistaken for other conditions, which is why diagnosis can be challenging. A key indicator of aortic valve regurgitation is a distinct heart murmur. This is a whooshing sound heard when a doctor listens to your heart with a stethoscope. The murmur is the sound of blood leaking back into the left ventricle. Now, what about the course of the disease? Well, aortic valve regurgitation can be either acute, happening suddenly, or chronic, developing slowly over time. Acute aortic valve regurgitation can be life-threatening and requires immediate treatment, while chronic cases can remain symptomless for many years. And how is this condition treated? The treatment options depend on the severity of the condition. In mild cases, regular monitoring and medication may be enough. In severe cases, however, surgical intervention may be necessary to repair or replace the faulty valve. Now, let's talk about electrocardiogram or ECG changes. In aortic regurgitation, the ECG may show left ventricular hypertrophy, which is the thickening of the heart's main pumping chamber. To sum it all up, aortic valve regurgitation is a condition where the aortic valve doesn't close properly, causing blood to leak back into the heart. This can lead to an increased volume of blood in the heart, which can cause symptoms like shortness of breath, fatigue, and chest pain. A distinctive heart murmur can be a key indicator of this condition. Depending on the severity, treatment can range from medication to surgery. So, the next time you hear the phrase aortic valve regurgitation, you'll know exactly what's going on in the heart. It's a fascinating, if somewhat daunting, glimpse into the inner workings of our most vital organ.